Good morning, everyone. Welcome to our second installment of our webinar series related to managed care. This one will be focused on SHOPP, our Supplemental Hospital Offset Payment Program, and the impacts to SHOPP as we transition from a fee-for-service delivery system to a managed care delivery system. So really appreciate all that are attending and your interest in the topic. Hopefully you'll find this informative, but also an opportunity to ask questions if you have those, especially for those who weren't able to attend our prior webinar on SHOPP in April. But I will try to go through this presentation pretty quickly, so there's plenty of time for questions, but also want it to be valuable to those attendees, and look forward to your feedback, your questions, and any other comments that you have. So with that said, we can get started, and I will jump to the next slide. So I know this is really focused on SHOPP, but obviously some big changes coming to the Medicaid program. So before we dive into SHOPP, I wanted to just set a foundation of where we are headed in the upcoming months with Medicaid. I know this probably won't be new to those folks attending, but some big changes. So just want to make sure I address those. First is SoonerCare Expansion, Medicaid Expansion. This was a vote of the people, so a constitutional mandate. On June 30th, 2020, Oklahomans voted to expand. The eligibility criteria will be adults ages 19 to 64 that don't already meet some type of medical criteria that qualifies for Medicaid. Those folks will have to have an income that is 138% of the federal poverty level or lower. So this is a big deal, and we understand our responsibility to execute the will of the people. So we've been preparing for this for a long time. We're ready to roll it out. Our application process will begin on June 1st, and coverage for these folks will begin on July 1st, 2021. And benefits under the expansion will mirror our SoonerCare benefits for adults today. So very similar in scope. And then the other big change is SoonerSelect, which is our managed care program. And we are, as I said earlier, transitioning from a fee-for-service delivery model to a managed care delivery model. This is a big change. And again, we don't take that lightly. We understand the responsibility on the agency to make sure this is done the right way. This will be effective October 1st, 2021. And not all populations will be transitioned or moved initially. So populations transitioning to SoonerSelect include our children, which makes up the majority of the Oklahomans on Medicaid. This will include custody kids or those in foster care. Low-income parents. We have a group that's currently eligible today we call them the parent caretaker group. They have a income around 40, I think it's 46% or below of the federal poverty level. And they also a caretaker of a minor or a caretaker of someone who needs a caretaker. Pregnant women will also transition, and then the expansion population we previously talked about. So adults ages 19 to 64 that are not aged, blind, or disabled. And that's important. We will maintain the age, blind, and disabled populations under fee-for-service. They'll continue as they are today. There's also some smaller populations like soon-to-be Sooners and Tefra that will not transition either. So we'll have kind of dual hats as we move to managed care. All medical and dental plans are required to have statewide coverage, so you won't have certain regional carriers that you'll contract with, and that's important as that means enrollees will have an option of all 4 plans on the medical side, all 3 plans on the dental side. And here are the partners that we've chosen to help us run the Medicaid program. Those include Blue Cross Blue Shield of Oklahoma, Humana Healthy Horizons of Oklahoma, Oklahoma Complete Care, which is a subsidiary of Centene, United Healthcare, and then dental plans will be DentaQuest, Liberty Dental, and MCA Dental. So with that, we can talk about what everybody's here to talk about, and that is SHOPP and the impacts of transition to managed care on our supplemental hospital offset payment program. So just some brief history. SHOPP was implemented in 2012, effective July 1 of 2011. This was state statute that required the Oklahoma Healthcare Authority to create this program, which was then approved by the Centers for Medicare and Medicaid Services for us to expend funds for a supplemental payment for hospitals. It's been a tremendously successful program, and we understand that hospitals rely on this revenue. So as we transitioned or are transitioning to managed care, one of the first thoughts we had and when we understood was we have to find a way to make SHOPP work in managed care. So that was our goal. Our focus was to preserve the supplemental payments, SHOPP being the largest one, but we have other supplemental payment programs. We wanted to preserve the funding level and structure of SHOPP to the greatest extent possible. So we have built a preprint, and I'm sorry, I'm using a technical term. CMS has a form called a preprint, which is our federal authority to pay the payments, similar to our state plan on the fee-for-service side. We built that with coordination and cooperation from the Oklahoma Hospital Association. We submitted to CMS, and they approved that document and our ability to make payments under a managed care delivery system on March 31st. So we are fully approved and ready to go for SHOPP directed payments in managed care, and we will be working on implementing our processes and procedures to make sure that our transition is flawless. So some important information, SHOPP will continue for non-MCO populations. So we will have parallel SHOPP programs for our fee-for-service population, which will be mostly ABDs, or age blind and disabled, and for our managed care population, which will be the populations we discussed earlier, our children and pregnant women, our parent caretakers, our expansion adults. They will have different programs, but the result will be a supplemental payment, much like you see today. So the assessment that hospitals currently pay, a assessment based on their net patient revenue, will continue as it is today. The Oklahoma Healthcare Authority will invoice hospitals for that assessment. You will only pay the Healthcare Authority, again, just as you do today. The invoice may look a little different. We may line item some or break out some of the dollars out of one line, and just to show you what you're paying for directed versus expansion or versus fee-for-service supplemental, also break out expansion. But again, one invoice from OHCA. The SoonerSelect SHOPP directed payment program will be for the MCO populations. And then when you combine the fee-for-service supplemental payment program and the SHOPP directed payment program and managed care, our intent and our belief is that in aggregate, those payments will be very similar as hospitals see today. So I'll shift my focus, talked about the parallel programs, but shift my focus to, specifically the managed care and what changes and what doesn't under a directed payment as opposed to the existing supplemental payment program. So federal authority changes, we talked about that, state plan currently, and now we move that into a CMS section 438.6C preprint. Payment type, really just names, supplemental payment versus directed payment. The supplemental payment will continue. It'll be from OHCA on the fee-for-service side. Their directed payment you will receive from OHCA or through the health plans. So those payments will just be coming from different sources. So instead of one payment today, you'll receive multiple payments. The pool categories was really important to us. We wanted to preserve the integrity of the design of the program. So again, we'll have a private and NSGO pool. We'll have a critical access hospital pool. The annual assessment, as we talked about, no change there. The utilization-based distribution. This is probably the biggest change from a structural standpoint, where we're going from a look back to a prior year to a look back to a prior quarter. The payments will still be quarterly, but we're going to have a more, I guess, reactive, real-time calculation of the distribution of funds to hospitals. So your utilization in the prior quarter will determine your payment in that quarter. If, I guess, to give some examples, if utilization of every hospital in the pool stays the same, then your distribution will stay the same. If utilization for every hospital in the pool goes up, your distribution will stay the same. Same thing with down. Now, if your utilization changes at a different, I guess, proportionally different than every other hospital in the pool, your distribution will go down, others will go up, and vice versa. So it's really the same as it functions today. That calculation exists, but it's a look back over a prior year rather than the prior quarter. And then payment frequency, again, is quarterly. It'll look very similar. Currently, we have a withhold in January for current SHOPP. I don't believe we will do that in our directed payment program as that wasn't part of the CMS approval. So the expectation is that we'll still continue to have the withhold on the fee-for-service side, but not on the directed payment side. And then a really important note is this payment pool is fixed. So how we characterize these dollars is they are separate payment terms and not at risk. So the managed care organizations will basically just be pass-through entities for these dollars, these supplemental funds. And that pool is fixed so that if utilization decreases or increases, the pool stays the same. Again, just like SHOPP today, that pool stays the same. So your utilization on your base and your base payments may change, but that pool of funds available for a supplemental payment will be fixed. The distribution may change, but the total amounts, the aggregate amounts will not. So just as I'm going to continue on this slide and just bring up a few key points. For a claim to be considered for a directed payment, which for an enhanced payment on top of your base, it has to be as a participating provider or a network provider or contracted provider, however you want to reference that. So if Hospital A has a payment from Blue Cross and Blue Shield, and they are a network provider, that hospital payment will be considered for an allocation of supplemental funds. If they are not a participating provider, it will not. So if you contract with all four, all of your claims will be considered. If you contract with one of the four, only claims from that one plan would be considered for a supplemental payment. So really important note, we encourage you to contract with all four because your enrollees will have an opportunity to contract with all four. And because then you can, maximize your revenue potential from Oklahoma Medicaid. With that, it'll be really important that we have claims to pay supplemental payments on, especially that first quarter as we transition and everything ramps up and we move populations to managed care. So really important that hospitals file claims quickly, and we will stress the importance to our plans that they pay those claims quickly. We do have, timely payment requirements in the contract with the plans. We will enforce those. But again, it's going to be vital that we get, an amount of claims that's good enough to support the amount of supplemental payment we'll have in that pool, that quarterly pool. So encourage you to do that. I know it's not as easy as just saying do it, but it is important. And again, to be considered for supplemental payment, it needs to be a paid claim in the quarter. And the payments to you will be lump sum as they are today. That's our intent. They will come from multiple payers, but otherwise look very similar as we will tell, OHCA will continue to calculate the allocation of payment, and we will send our plans a report and funds to make the payment, and we will ask them to do so within 7 days. So we're trying to do our best to keep the timing of assessment to payment the same. We know that's important cash flow wise, and we want to continue that process. So this is a diagram to try to show visually, the owners of each part of the process. And it's pretty simple, but this helps me visualize it, and hopefully it helps you as well. So on the left side, you'll see the regular reimbursement process, and that's just claim or services rendered, claim is filed, payment back. So of course that base claim and base payment will be to the MCO, and the MCO will pay that claim. Again, for the populations transitioning to managed care. The difference here is the supplemental portion, the directed payment. So MCO will send OHCA encounter data. We will utilize that data to analyze and determine the allocation of funds available within the fixed pool. Again, the assessment doesn't change. You guys are used to that routine. And then OHCA will send a report to the plans along with funding to pass through those payments to hospitals. And number 4 there on the right shows you the 7-day window that we will ask plans to pay within. So I know this is really SHOPP focused, and hopefully that was a helpful, albeit quick overview. But there are other directed payment programs that OHCA is seeking approval from CMS. And I just wanted to go through those really quickly. These mirror our current supplemental payment programs in fee-for-service. So again, preserve the level of funding and structure to the greatest extent possible. A level 1 trauma payment program is for our level 1 trauma hospitals in the state, which we currently only have one. That's OU Health. So they have a program for themselves, basically, since they're the only level 1 trauma hospital, that is very similar to SHOPP, and will continue to be very similar to SHOPP. Enhanced physician payment program is a enhanced payment for our university affiliated docs, MDs and DOs. This is a payment that aligns with commercial rates. And it's a payment mechanism we've had in place for over a decade on the fee-for-service side. And again, we wanted to preserve that as we move to managed care. And the last one is our enhanced tier payment system, which is a supplemental payment designed for community mental health centers, providing much needed behavioral health services, which again we wanted to make sure we preserve. So a few others, just for FYI, the level 1 trauma payment program has been approved by CMS, but the other two have not yet. We feel like those are in the final stages of approval and will be approved soon. So hoping that happens and we get the approval document. I think with that, I believe that is my last slide. Yeah, we can move to Q&A. I'll stop sharing here and we can start taking questions. A question from Amanda: what happens to the CMS section 438.6C preprint approval for directed supplemental payments if CMS doesn't approve the full transition to manage Medicaid in Oklahoma? Will the MCO population remain? So yeah, absolutely, Amanda. If for some reason CMS didn't approve, or for another reason managed care doesn't go live on 10/1, we still have the approval and the ability to pay supplemental payments SHOPP on the fee-for-service side. So we would continue until implemented, paying as fee-for-service. So our state plan was not withdrawn; it still exists. As long as we are not transitioned to managed care, the fee-for-service supplemental payments move as they are today. There will be some likely statutory changes that are coming to give us the ability to pay either or. But yeah, your assumption is correct. And I know I had a call, I believe 2 weeks ago, early or late April. I probably addressed a lot of questions. So while we're waiting, I just wanted to remind everyone that, you know, myself and Jimmy Witkowski, who really administers our SHOPP program, are available. You know, if a hospital wanted to have just a direct conversation with us, or email exchange or request, we're happy to do that as well. Our email addresses are all standard, pretty simple. It's our first name dot last name at OKHCA.org. So mine is aaron.morris@OKHCA.org. So if you want to reach out, I'm happy to respond to any questions or have a targeted or detailed conversation. I also encourage you to regardless of managed care, reach out to us and keep us kind of apprised of any major changes or changes that you think might impact your supplemental payments. Hiring a new OB that increases capacity or otherwise, those are factors that we can sometimes weave into our calculations of the pool amounts, and potentially increase your supplemental funding. So we have worked with hospitals in the past to do so, and we're open and willing to have any conversations that are necessary. So I'll give it a couple minutes here, see if there's any questions, and then if not, we can adjourn. What keeps the MCOs from holding the SHOPP payments received from OHCA and delaying payments to hospitals? I mean, we do, as the agency sending those funds, we will have a contractual agreement with the MCOs that they will have to do what we ask them to on the directed payments. A violation of that contract could have monetary penalties. It could also, have escalation clauses that potentially could lead to termination if it was a repeated or, intentional effort. So, our contract will guide a lot of our operations and our monitoring and oversight of the plans. For these payments, again, really, they have no, I'm not going to say they have no incentive to hold the payments, but really there's no ability for them to make money on these payments. So it's, you know, our contract will guide that and guard from that. Well, we have timing change and notification and payments of assessments with change to quarterly look back. No, Robert, again, our goal is to keep the timing very close to it as it is today. So just for those on here that may not know, assessments are due the 15th month or 15th day of the first month of each quarter. That will continue. My understanding is there's no planned change on that in statute. So currently we pay within 10 days of receipt of assessment. Our goal is to receive the encounter data within a week after the month ends, analyze that data the following week, and send the report to the plans the following week or within that second week. So they will be able to send payments within 7 days, and that timeline will line up with our current existing process. How will claim denials factor into utilization for calculating the supplemental payments? I know you mentioned the utilization is based on paid claims, so we are trying to understand the impact denials will have on supplemental payments. So just as today, yes, it's for paid claims only. So our allocation will be based on those paid claims, and you know that's a function of our fee-for-service supplemental payment as well. We do not factor in or account for denied claims. And we'll continue to not do that. That CMS would require that be on a paid claim. Just I guess additional information as you go into denials, we will have specific monitoring efforts on claims denials and denial rates and denial reasons, and require reporting from the plans, especially if we see a spike in denials. And we understand as we roll this out, that's going to be really important even early on. So we'll be working on our monitoring oversight piece for claims denials very quickly. So let's give it one more minute and see if any other questions come in. I think we originally had 30 minutes scheduled for this and extended it to an hour. So it looks like the 30 minutes might be sufficient. All right, no other questions. Oh, there's one. Is OHCA projecting an increase to the assessment rate for MCO fee for service or fee for service supplemental? So no. Now we project a increase in the assessment, or we increase the assessment rate to account for expansion. And then we increase the assessment rate to account for growth in the gap, the UPL gap, which is what we use to develop the pools. But the pools developed the same way on both sides. It's just split. So the assessment rate doesn't change regardless of MCO, fee for service, anything. We just split the responsibility of the assessment rate for which program. So no, only impact for the assessment rate was growth in the upper payment limit gap and expansion population. All right, with that, I think we can go ahead and close it down, adjourn the meeting or the webinar. I appreciate everybody attending. Amanda, you had really good questions, really specific questions. So happy to have a follow-up if you would like to have a direct conversation, just give me a call or shoot me an email and we can set that up. So again, appreciate you guys. Let me know if you have any other questions, but thanks for attending.